Knock, knock. Hello, my name's Brianna. I'm going to be your nurse today. Can I have your name and date of birth?
Richard Lee, and my birthday is August 24th, 1996.
Okay, and do you have any allergies?
No, I do not.
All right, and can I get you anything before we start our head-to-toe assessment to make you feel more comfortable?
No, I'm good.
Okay, so we're just going to do a head-to-toe assessment today. It's just going to take maybe 10 minutes. Do you have any questions before we start?
No.
Okay. All right, so I'm noticing that he is dressed appropriately for age. He's alert. He knows his name, so that's good. Do you know where you are right now?
I'm at the hospital.
Okay. And do you know what year it is?
2018.
Okay. So for our first assessment, I'm just going to go ahead and take a baseline set of vitals. So I would normally go ahead and do blood pressure, respiratory rate, pulse, and also I might grab his SpO2 as well just to see where his saturation is. Are you in any pain today?
No.
Okay. Now I'm going to go ahead and, do you know how tall you are?
I am 5'7".
And I would normally grab his weight on some kind of device to calculate his BMI. He does not quite qualify for Braden scales. He appears normal and healthy for his age. So we're going to go ahead and start with, I'm just going to go ahead and look at your eyes. So we're going to look for pupils that are equal and round. So we go ahead and take your glasses off. I have a light come around towards your corner here, and you just look straight at my nose. Okay. Keep looking at my nose. Pupils are dilating and consensual. If you want to go ahead and follow this pen light from right here. And we'll just go ahead and do our EOMs, so just make sure all his muscles are. So if you want to go ahead, follow this right up here. Tell me if I need to slow down or if I'm going too fast, okay?
Okay.
Alrighty. Okay. All right. Perfect. So he is he's kind of perla. So pupil equal, round, and reactive to light, and also accommodating. So good there. I'm gonna go ahead and put this down. I'm gonna go ahead and look at your color. So his color is even, equal, pink undertones. Everything's symmetrical from what I can see, and I'm going to go ahead and check his capillary refill. I'm just going to go ahead and pinch your skin, and the comes back is normal, under 3 seconds. And I'm also going to check for clubbing, so I don't see any clubbing. I'm probably just going to keep starting. I'm going to actually just do a whisper test, so if you can cover this ear, I think this is your left ear. Either ear, just cover each. Perfect. Let's go this way. And then I'm going to whisper, and you're going to tell me what word I said, okay?
Pizza.
All right, we're going to do the same thing on the other side.
Potatoes.
All right, good. Good. I'm going to just go ahead and palpate. Sorry, my hands are a little bit cold, so I'm just going to assess your ear here. So is there any pain there?
Nope.
I don't see any discharge or discoloration. I'm going to go ahead and go to the other ear. Is there any pain here?
No, I'm good.
Are you good?
Yes.
Okay. Sorry, it's cold. No discharge or discoloration. Everything seems symmetrical there. Now I'm going to go ahead and assess your nose. So if you can go ahead and cover one nostril and breathe in. Okay. Left nostril is patent. And then I was saying with the other eye. Right nostril is also patent. If you also could smile for me. Puff your cheeks. Good. Okay. So I see that he has a symmetrical face. Cranial nerve 7 is intact. If you could go ahead and I'm going to look in your mouth real quick, okay? And say, ah.
Ah.
All right, so uvula is midline. Cranial nerve 12 is intact. I don't see any lesions or redness or sores anywhere. Do you wear dentures at all?
Nope.
Okay, wonderful. Now I'm going to go ahead and, let's see. We're just going to go ahead and do, I'm going to go ahead and listen to your breath sounds, okay? So first, so make sure I got this. Is that on? Yep, we're good. Okay. And if you could do deep breath here. Deep breath here. Deep breath here. Deep breath here. I'm going to go around to this side over here. Around to the opposite here. Okay, now I'm going to go ahead and auscultate your back lung sounds here. Deep breath here. Okay. Right around here. Okay, so he has equal chest rise bilaterally. I don't hear any wheezing, crackles, rails, or ronchi. Now, did you have any difficulty breathing in the past, or
Nope.
no? Pretty much. Okay. So that seems all good. Now I'm just going to go ahead and listen to your heart real quick, just your apical heart for a minute. And we're going to assess the rate and rhythm of it, okay? You don't have to do it? Okay, so I'm just going to say that I did it. This is normally where I'd be. I would listen for a minute, so heart rate is equal in rhythm and no murmurs or anything, so that's good. And now I'm going to go ahead and I'm going to go ahead and assess for edema. So first we look at that for in your legs. So if you could just, sit a little straight. Thank you. Perfect. All right. So I don't palpate any edema here. So I put that as a 0. And then for a pedal pulse or a pulse, I don't assess, or I assess equal pulses here. So that would be a 2+. And if you want to go ahead and we're going to just test your muscle strength real quick. Oh, and I don't note any JVD either. So I'm going to go ahead and do just a quick muscle test real quick just to see how your muscles are doing here. If you want to go ahead and put your arms up like this, and I'm just going to... And if you could go ahead and resist my arms. And then I'm also going to ask you if you could shrug your shoulders real quick against resistance. Wonderful. Okay, and I'll do the same with your feet, I guess. This one too. All right. I actually don't remember. If you want to lift your legs, okay, and then maybe like back here, that works fine. I'll do. That's going to be a 5+, so that's exactly what we're looking for. I don't notice any weakness on any side. If you could go ahead and stand up and walk to me in a straight line. Okay, so gait is normal. There's no swaying or irregularities noted there. All right, now we're going to go ahead and look at your abdomen. So if you could go ahead and lie down. Just to where you're comfortable. Do you want to move up a little bit? Okay, you're good? All right, so first I'm going to go ahead and inspect. I don't notice any irregularities. He's flat, round, contours good. And I'm going to go ahead and auscultate. Just listen for bowel sounds in all 4 quadrants. Oh, that's wrong. Yeah, okay. We're going to start in the right lower quadrant. Normally, if I couldn't hear any bowel sounds, I wait for at least 5 minutes. But I hear all his bowel sounds, so that's good. Now we're going to go ahead and percuss. Starting again with the right lower quadrant. And I'm looking for any dullness or masses, and I didn't notice any timpani is good. I don't remember what the other one is, but so he's all good there. And then also I'm gonna palpate. So we do this last because we don't want to disrupt anything. So again, we'll start at the right lower quadrant, and then across here. Do you have any pain when I go ahead and palpate that? Okay, good. All right, you can go ahead. I think let's sit up. Right. Yes. And do you notice anything different with your stools? Or bowel movements? Do you have any pain or any discoloration? Okay. And how about when you go to the bathroom when you pee? Nothing.
Nope.
Nothing there. No burning, itching, redness, or blood that you notice. Okay. That's pretty much it. All right. Well, can I get you anything before the doctor comes in?
Water.
Water? Okay, I'll be right back and go get you that water, and the doctor will be right in, okay? It's very nice to meet you.
Why, thank you.